Hey everyone, welcome back to all my listeners. It's the start of a brand new month and a brand new season on the podcast. This is the 192nd episode in season 12. That's right, you heard me correctly. This is episode number 192. Holy moly. And that is right. This is my third year of podcasting, and this is season 12. So welcome. Today is Wednesday, May 1st, 2024. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, now let's get into today's episode. Today's Newsworthy is going to be involving adverse effects from Botox injections. And in my Trusty Tip, I wanted to highlight a couple of deleted steroid codes that have been replaced with one new code. And I'm going to be focusing season 12 on a brand new spark, this spark of collaboration. And I'm going to go ahead and round out today's episode with the remarkable quote by Henry Ford. Today's episode is sponsored by Advanced Coding Services. Let's get into it. Today's episode is sponsored by Advanced Coding Services, a leading medical billing and medical coding school in the United States. Whether you're just starting out or a seasoned professional, our training equips you with the tools and support you need to advance your career. Our medical billing and coding school meets your needs worldwide online or in person with one-on-one support throughout your training. We are committed to helping our alumni and credentialed medical community in keeping up their certifications by offering various avenues for acquiring your continuing education units. In addition to our Mastering the Business of Medicine retreats offered several times throughout the year in different parts of the country, we now offer memberships. You can conveniently earn your CEUs by attending our exclusive members-only webinars. Since our aim is to nurture and grow the careers of individuals who work in the business of medicine, we call our member area the Apple Orchard. Advanced Coding Services, educate, nurture, inspire, reaching back with a hand up. So let's get into Newsworthy. The Centers for Disease Control and Prevention, that's our CDC, has issued an official health advisory on adverse effects linked to counterfeit or mishandled botulinum toxin injections. Botulinum toxin injections are also known as Botox when used for cosmetic purposes. The CDC issued this advisory to alert clinicians about risks of counterfeit or mishandled botulinum toxin injections. The CDC, as well as the U.S. Food and Drug Administration, that's our FDA, and state and local partners are investigating clusters of 22 people in 11 U.S. states who have been reporting adverse effects after receiving injections with counterfeit botulinum toxin or injections administered by unlicensed or untrained individuals or in non-healthcare settings, such as homes or spas. 11 patients were hospitalized and none have died. When botulinum toxin diffuses around the injection site, it can result in adverse effects. Botulism is the disease caused by botulinum toxin circulating in the blood and producing effects remotely from the injection site. There may be symptom overlap between the presentation of localized adverse effects from injection of botulinum toxin, especially in the head and neck, and the early symptoms of botulism. Information about the botulinum toxin injection can help distinguish between botulism and localized adverse effects, but is challenging to obtain for counterfeit products. Clinicians and health departments should consider the possibility of adverse effects from botulinum toxin injections in patients presenting with localized paralysis. Clinicians should immediately contact their state, tribal, local, or territorial health departments if they suspect botulism. Let's go over some background details on botulism. Botulism is a rare and sometimes fatal illness caused by the botulinum toxin. Initial botulism symptoms may include double or blurred vision, drooping eyelids, slurred speech, difficulty swallowing, and difficulty breathing. These symptoms may be followed by a descending, symmetric muscle weakness that progresses over hours to days. Administration of botulism antitoxin can neutralize toxins circulating in the blood. Therefore, treating botulism patients with botulism antitoxin early in the course of the disease can prevent the progression of paralysis and consequent complications. Administration of antitoxin is not indicated for local effects of low-dose injections of botulinum toxin preparations because the low doses of the injected toxin are not likely to reach circulation or produce botulism with its life-threatening manifestations. Some localized paralytic effects resulting from diffusion of the toxin around the injection site are expected from botulinum toxin administration. Most individuals with localized symptoms like dysphagia after injection to the neck, following low-dose cosmetic, again, those are called those Botox injections, or therapeutic injections using FDA-approved products, again, Botox, will not require treatment with botulism antitoxin. Iatrogenic botulism can occur after cosmetic or therapeutic injections of botulinum toxin when the toxin circulates in the blood and produces effects remotely from the injection site. Iatrogenic botulism is rare. The most recent laboratory-confirmed domestic case occurred in 2017. Now, as of April 18th, 2024, again, just a few weeks ago, 22 people with adverse effects have been reported in California, Colorado, Florida, Illinois, Kentucky, Nebraska, New Jersey, New York City, Tennessee, Texas, and Washington. Symptom onset dates ranged from November 4th, 2023 to March 31st, 2024. All symptomatic people were females aged 25 to 59 years. All reported receiving botulinum toxin injections by unlicensed or untrained individuals or in non-healthcare settings, including homes or spas. Most reported receiving botulinum toxin injections for cosmetic purposes. Among all 22 people, symptoms began a median of 3 days after exposure and included symptoms near the injection site. Those symptoms included blurred vision and ptosis after facial injection. They also further included dry mouth, slurred speech, shortness of breath, fatigue, and generalized weakness. Of 20 people with information available, 11 symptomatic people were hospitalized. 6 of the 22 symptomatic people received botulism antitoxin to treat suspected botulism. 7 symptomatic people underwent botulinum toxin testing to determine if they had circulating botulinum toxin, which would support a diagnosis of botulism. Results were negative for 6 symptomatic people and are pending for 1 symptomatic person. Negative results do not rule out botulism, as levels of toxin in serum may have fallen below the limit of detection of laboratory tests. None of the 22 symptomatic people met the case definition for botulism, and none have died. These adverse effects have been linked to improper procurement and administration of botulinum toxin. Botulinum toxin should be administered only by licensed providers using only recommended doses of FDA-approved botulinum toxin, again, Botox, preferably in a licensed or accredited healthcare setting. Providers should be trained in the proper administration of botulinum toxin, practicing in accordance with state and local requirements. Now, let's go over some recommendations for our clinicians for their diagnosis, consultation, and treatment. So, consider the possibility of adverse effects from botulinum toxin injections, including those given for cosmetic reasons in patients presenting with localized paralysis near the injection site. Ask patients about their history of botulinum toxin injections, including the dosage. Be aware of symptom overlap between the presentation of localized adverse effects from injection of botulinum toxin and the early symptoms of botulism. To help distinguish early botulism symptoms from localized adverse effects, you should be assessing for symmetry of cranial nerve palsies. Symmetric cranial nerve palsies are expected with botulism. You should be assessing for progression of cranial nerve palsies, possibly followed by a descending symmetric flaccid paralysis. These should raise suspicion for botulism. If botulism is suspected, call your healthcare department immediately for consultation. Health departments and healthcare providers can contact the CDC Clinical Botulism Service directly 24/7. Now, if the public health clinical consultation supports botulism, Request antitoxin and begin treatment as soon as possible. Do not wait for laboratory confirmation to begin treatment. Now, when it comes to clinician reporting, a suspected case of botulism is a clinical and public health emergency. Suspected botulism cases should be reported immediately to the 24-hour emergency contact of your health department. Report adverse events related to the use of any medications, including suspected counterfeit medications, to the FDA's MedWatch safety information and adverse event reporting program. Now, when it comes to counseling your patients, counsel patients who report using or being interested in using botulinum toxin about potential adverse effects. Advise your patients to receive injections only from licensed providers who are trained in proper administration of FDA-approved botulinum toxin products like Botox, preferably in a licensed or accredited healthcare setting. And now it's time for my best practice tips in Trusty Tip. There's a new HCPCS code that was just released. This is for our HCPCS code J1010 for injection. Methylprednisolone acetate, 1 milligram, has been added and made effective April 1st, 2024. Now, practices, there are many that utilize this type of injectate, but a common one is our orthopedic types of practices. So make sure that your physicians, your nurses, and your APPs are up to date on coding for this injectable methylprednisolone acetate or steroid type of product. Now, there are 3 HCPCS codes that are no longer active as of April 1st, 2024. And those are our outdated HCPCS codes J1020, J1030, and J1040. Now, these corticosteroid codes have been long used by our practitioners and our coding professionals. They've been in effect since way back in 1982, but they were administered in different dosages. Like, for example, our J1020 was for 20 milligrams. Our J1030 was for 30 milligrams, and our J1040 was for 80 milligrams. But now, with the new inclusion of our brand new code on April 1st, 2024, again, that's our HCPCS code J1010 for injection, methylprednisolone acetate 1 milligram, our practices should be using that new code instead. Now, the change means that you will need to report 1 unit of that HCPCS code, J1010 per milligram. So, for example, if 35 milligrams are injected, you should report J1010 with 35 units. So on that claim form, you have to have 35 units being applied to the CMS 1500 claim form. Now, both physician offices and facilities are impacted by this change. Make sure that you're also using the National Drug Code, that NDC number on the claim form, and make sure it's being aligned with the new HCPCS code J1010 and not from the newly deleted HCPCS codes J1020, J1030, and J1040. So make sure you take this information back to your practices and get them updated on the new code that's been added for these corticosteroid types of products, J1010. That's been in effect since April 1st, 2024. And finally, I focus Season 12 Spark on collaboration. I want this 12th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who places value on collaboration. So, in this week's inspiring quote in Spark is from Henry Ford. If everyone is moving forward together, then success takes care of itself. Absolutely true, right? This quote reinforces the collaborative nature of success. We rarely dive into work alone and singular. We rely on a team of people. It could be a small team, or a large one, but it is a team nonetheless. When we all strive towards the same purpose, the same end goal, we are moving forward with deliberate and thoughtful action. I'm happy Henry Ford's spark still burns brightly in all of us today. So that wraps up today's episode, and as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, all right, you guys, remember to catch my LinkedIn live broadcast with my good friend Betty Hovey on Friday for our very first May Compliance Capers. Now, this entire month, we are going to be focused on corporate integrity agreements, or CIAs. Now, make sure if you can't catch us live on LinkedIn, you can always watch the full video version on my YouTube channel for Paint the Medical Picture. Now, I wish you guys all an amazing and very, very happy week ahead. Thanks so much for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.